Hello again, Mrs. Robertson. So last week we saw you and we did toothbrush you with you. How are you getting on with that?
Fine, yes.
You're finding that okay? I've noticed quite a difference in your charts. The plaque has reduced considerably, particularly behind your front teeth. So you've done really well with that. The one thing I've noticed though on you, because still see on the chart a couple of areas where there's still the yellow triangles showing a wee bit of plaque, and it's in the gaps in between your teeth. So what I'm going to do is show you how you can, get rid of that plaque there. Do you use anything in the gaps at all? No, you don't use anything like that. Okay, I'm going to show you some little brushes that we can use for in those areas. There's various different brands, but the one that we have here are the TP brushes. Have you seen these before?
I haven't.
You've not, okay. So this is a TP brush. You can see it's a funny shape. It's got a nice handle for holding on to, and it's also got a little brush, a very fine brush at the top. It comes with a lid, okay, and that lid can protect it. You can also use that as a handle, so it makes it easier for you to use. And we're going to show you how to put that little brush in the gaps between your teeth and to get rid of the last of the plaque that's still sitting there, and also help to reduce you getting problems in between your teeth, either tooth decay or gum disease. Okay. Now the brushes come in different sizes, and it's important that you choose the correct size of brush for your teeth. Right? In the shops you can find that they have variety packs of those. You can have a selection of them, and until you get sorted you can maybe buy that pack. Each one of these little brushes should last about a week. So rinse it out under the tap. You're using it once a day, and then at the end of the week, and normally the thin ones, the wire's bent anyway, you would just discard it and start with a new one. Okay. So I'm going to show you, I'm going to check for the area that we're, that suits this size of brush, and I'll let you feel how it's going to fit, so so that it's most effective for you. Okay. So I'll give you the mirror to hold. Okay.
Thank you.
Right. So I've been looking along the front teeth here. Okay. We'll stretch your lip back, and you've got these little gaps down here. Okay. So let's see how we got on. I'll take the brush, and I'm just going to insert it in between your teeth here. A little wiggle, and that goes in. Okay. Can you see how that fits in? Try it in this area. Okay, let's try that there as well. So that's the perfect fit. This is the best fit in this hole. And what we're trying to do is ensure that the bristles are cleaning your teeth, but that the wire's not rubbing on it. Okay. So if you feel the wire rubbing, which is a wee bit tight here, feel the wire rubbing, you would go down a size, and that would be pink. Okay, and again in that area it would be pink. A little wiggle sometimes to get it through, but you don't want to be sticking this wire into your gum. Okay, so you're not going to hurt yourself when you're using that, although it's wire. Do you want to show me you using that? That's good. Now what I want you to do is move the brush in and out a bit, so that that's it. You're using the bristles on it to brush off the plaque. That's it. Good. Okay, try this tooth to this side. That happens. And occasionally you get stuck. Just just relax and take it out carefully. Is that going to go in? There you go. Quite happy with that? And you're going to clean the plaque off. Now remember, you've got two sides, the size of two teeth there. So adapt the TP brush so that you're getting the plaque off both teeth. Okay. Well, that's good. So you can see there you've got some bleeding there, and that's just because you've not been in there with a brush before, and the gums are bleeding. Now that's not because you stuck the TP into your gums, that's because there's a bit of inflammation from the plaque. It'll take about 7 to 10 days for that to heal and to get better if you continue to use your TP brush, okay? And you'll see a difference after that time, and the bleeding should stop. So don't panic when you see bleeding like that. Okay. So we're going to check some of the other sizes of the gaps in your teeth. Sometimes the back teeth have slightly larger gaps. So let's try another size of brush.
Thank you.
So I've got a red TP. Where did we have the red TPs? Lower, it was on the lower right. Okay, so we're going to do test along this side here and between your premolars. It can be a bit tricky to get in there just going straight, so you can bend the end of the TP brush, okay? And that'll make it easier to adapt in there. And let's go in here, this area here. And that fits perfectly in there. See how that fits? And it makes it easy for you to use there. And the same in there. Can you see me doing that wee wiggly movement just to get it in? That's super. Sometimes it's difficult to get in from the outside, and you may find it easier to go from the inside. But you can certainly adapt. You can go from either side, anywhere in your mouth. Okay. Want to have a try of that? You show me you using that. Do you want me to hold your cheek back for you? There you go, that's easier. Good. And again, you're remembering it's the front of one tooth and the back of another. How are you getting on up there? I would maybe bend the